Good morning, Professor and colleagues. My name is Dr. Nguyệt. I'm from Hà Nội Medical University and Vietnam National Children's Hospital. Today, I'm very happy to present the report to all. The name of the report is Anti-N-M-D-A Receptor Encephalitis after Herpes Simplex Encephalitis in Children, a report of 11 case series. My presentation consists of 5 parts. Herpes simplex virus is a common cause of encephalitis children and adults. The disease is mainly monophasic, but 12 to 27% of cases had recurrent neurological symptoms after stopping acyclovir treatment for a few weeks, and PCR HSV were negative in CSF. A common symptom in children after HSV encephalitis is movement disorder. Many researchers support the hypothesis of an immune-mediated disorder because antibodies against the gluten-1 subunit of the NMDA receptor are detected in the CSF and blood. Anti-NMDA receptor antibody appear 1 to 4 weeks after HSV encephalitis. The mechanism of autoimmune encephalitis remain unknown. There are several theories. Early diagnosis of this disease is important because immunotherapy treatment is effective and help improve the quality of life of the patient. Over a period of 2 years, we collected 11 cases of patients with recurrent symptoms after HSV encephalitis at the National Children's Hospital. About objective, we report clinical and paraclinical characteristics and long-term outcome of 11 patients with relapsing symptoms post-herpes simplex encephalitis in children. This is a case series study we carry out from November 2019 to December 2021 in National Children's Hospital. We collected 11 patients who experienced recurrent or new neurological symptoms after treatment for HSV encephalitis. The patients were negative for HSV. All patients were tested for NMDA receptor antibody and 5 patients with 6 autoantibodies. Additionally, all patients had an EEG and brain MRI at the time of relapse or the appearance of or new neurological symptoms. Each patient will follow up for at least 12 months. Evaluation of treatment response according to the ranking score scale. Sequelae of epilepsy manifesting after the acute phase of the disease. Good outcome when ranking score is equal or less than 2. Poor outcome when ranking score is more than 2. To assess psychomotor development by using Denver 2 scale. We use ranking score to evaluate treatment effectiveness. We have some results. Our study had 11 patients, including 8 male and 3 female. A median age was 50 months. The average time of disease onset at HSV infection was about 23 days. During the acute phase of HSV encephalitis, most patients had fever, focus seizure, and impaired consciousness. After that, most patients had an improvement in mental status. In the relapse state, most common symptoms were choleral arthritis and recurrent impaired consciousness and relapsing fever. So, if the patient had appeared these symptoms after the period stable, we should suggest this condition of autoimmune encephalitis. About subclinical feature, all patients were investigated for CSF, EEG, and MRI. The results show that all patients had anti-N-methyl receptor in CSF. We also found that more than 80% of patients had abnormal CSF, and all patients had abnormal EEG. About treatment and outcome in first-line immunotherapy, 8 patients need to combine of steroid, high-dose steroid, and immunoglobulin. Their condition didn't improve. So we decided add to second-line immunotherapy by rituximab. And follow up 1 year. We follow up 1 year. 10 patients had epilepsy, and all patients had psychomotor development retardation. This graph shows that the trend of ranking score over the course of treatment. Initially, most patients had a ranking score of 5, and after 3 months, there was an improvement in ranking score. And follow up after 1 year, ranking score, there were 20% of patients had ranking score below 2 points. Poor outcome may be most patients has extensive brain damage in the acute phase of encephalitis, of SFV encephalitis. In conclusion, anti-N-methyl receptor encephalitis can occur after herpes simplex encephalitis in children. The most common symptoms are choleral. Clinicians should consider N-methyl receptor antibody encephalitis if a patient has relapsing neurological symptoms and determine anti-N-methyl receptor antibody in CSF. Treatment with immunotherapy can be effective, but most patients had several neurological sequelae, including refractory epilepsy and psychomotor retardation. Thank you for attention.
Thank you, Dr. Nguyệt, and again, congratulations, Dr. Nguyệt and your team to get the poster work yesterday.